Welcome to the PT on Ice Daily Show. It is the best day of the week here at the Institute of Clinical Excellence because it's Fitness Athlete Friday. Today I'm your host, Dr. Zach Long, and lead faculty inside the clinical management of the Fitness Athlete Division. And I'm excited to talk today about anterior shoulder pain with horizontal pressing movement. So we're talking about the bench press, the push-up, the dips as horizontal pressing movements, which are going to be common complaints of areas of pain that you hear in fitness athletes, so CrossFitters, powerlifters, and Olympic weightlifters. And I want to give you a couple of key takeaways of what to look at and think about when you are working with this population dealing with anterior shoulder pain during those movements. So before we dive into that topic, we've got a couple of upcoming courses next weekend. So April 17th and 18th, we've got 4 courses going on. In Victor, New York at Limitless PT Specialist, we've got modern management of the older adult happening. Norfolk, Virginia, Mitch will be teaching clinical management of the fitness athlete, our live course that weekend. Jordan Berry will be in Phoenix, Arizona, teaching cervical spine management. And Zach Morgan will be teaching lumbar spine management at Onward Nashville in Hendersonville, Tennessee. So let's dive into today's topic, anterior shoulder pain with horizontal pressing movement. So again, this is going to be something that you hear a lot of athletes complain about when they're doing dips, when they're doing bench press, when they're doing push-ups, getting pain on the front side of the shoulder. And so what do we need to do and go about in our examination and in our treatments for these individuals? So number one thing you have to do when this shows up is you have to talk to these individuals about their training volume, because very frequently in like the bodybuilding, powerlifting world, you're going to find that something has happened in their training volume recently to where that spiked up. Maybe they started a bench specialization program where they're benching instead of once a week like maybe they typically do. Maybe they bump that up to 2 or 3 days per week. Maybe it's a CrossFit athlete and they've started to, like my last patient that just left the clinic here, has just started to increase his work on dips and ring muscle-ups, trying to get back to doing ring muscle-ups about 1.5 years after his shoulder surgery. And that volume of working through that movement has started to irritate the front side of his shoulder. Or maybe the gym itself is doing a cycle of programming where they're focused on building horizontal pressing strength for a little while. So every now and then I'll run into a CrossFit gym that maybe started like a bench press cycle where every week, once a week, they're doing a bunch of heavy bench presses, which is not a super common movement to see in CrossFit, but every now and then you'll see that pop up in a cycle. So look at training volume first of all. And that's pretty much a key when we're talking about any injury in the fitness athlete. The first step is almost always going to be look at training volume and their programming and what's happened around their programming. If you're not familiar with analyzing programming, then I would check out our advanced concepts in the clinical management of the fitness athlete division. That course dives deep into programming. We only run that course 2 or 3 times a year. Just started one course now, so you'll have to look at future dates down the road. But after looking at training volume and overall training volume, then the obvious answer here is to load the rotator cuff. And to load it, especially if you can kind of narrow down which parts of the cuff are being overloaded and kind of bias that a little bit more. So a lot of times I'll do a manual muscle test of external rotation and internal rotation. So testing that in both positions. And I'm not doing that to grade it on a 0 to 5 scale. I'm doing that more to maybe identify which of those directions might be a little bit more sensitive. So in the guy that I was just working with this morning, when I tested external rotation manual muscle testing, not any pain with that. When we went internal rotation manual muscle testing, that really quickly reproduced his pain. And so for him and our loading strategies to kind of build that tissue strength up a little bit, we're going to be focused a little bit more on building that anterior rotator cuff. We're going to load that subscapularis a little bit more with him to make that muscle a little bit more tolerant of loading. So obviously we're loading the rotator cuff, but let's get into more of the specifics of what we need to be thinking about with these 3 specific movements of the bench press, the push-up, and the dips. What can we modify there? What cues can we give, etc., so that you can maybe more rapidly change their symptoms? Because it's going to take, when somebody's dealing with a tendinopathy, we know it's going to take a period of time for that tendon to kind of get its strength rebuilt. But what can we do that will really change their symptoms really fast? So let's start with the bench press. So number one thing to look at and maybe adjust is their elbow angle. So a lot of times when I see individuals dealing with anterior shoulder pain, we're going to see a really high elbow angle. So almost like their humerus is creating a T in relationship to their torso. And a lot of times going that high is going to put a little bit more stress on the shoulders. And so I typically coach most people to bench at more of like a 45-degree angle of their humerus in relationship to their torso. So essentially they're making an arrow-shaped body, not a T. And a lot of times that will really quickly help change their symptoms. The next thing that I really want to look at when I'm analyzing their bench press technique is what do they do with their shoulder blade? So in the bench press, as that individual laying down, we want to see that their scapula are really retracted and depressed. And then we're really squeezing shoulder blades back towards each other. And quite often we're getting a really large arch positioning in the back. And the combination of the arch positioning back plus scapula being squeezed will really hold the shoulder back. And as that individual is then going into shoulder extension, what that will prevent a lot of times is the shoulder from kind of anteriorly dumping, from that scapula from anteriorly tilting. If that scapula anteriorly tilts in the bottom of a bench press, that is going to create a little bit more stress on the anterior shoulder. And if we're talking about a tendon that is inflamed, that anterior tilt of the scapula is going to put a little bit more pressure and a little bit more compression on the structure of the anterior shoulder. And so a lot of times just fixing that scapula positioning, getting them locked down will help to really modify their symptoms really fast, as well as being a better position for them to overall lift load in. So from a performance perspective, that will help them out significantly. What you'll find a lot of times though is when those individuals can't hold that scapular retraction and depression during the bench press, a lot of times they lack some shoulder extension range of motion. So I will assess shoulder extension range of motion and we'll address that if that is limited a little bit, because that will change stuff quite a bit. So that's where I'm going treatment-wise in terms of those movements and loading. But what are some things I do when somebody's dealing with pain and they need to bench press? So let's take a power lifter that comes into the clinic and they've got a competition coming up in 2 or 3 months. You know that it's going to take some loading to calm that irritated tissue down a little bit, but they can't just stop training. They need to continue trying to improve their fitness and performance because something that they care about is coming up. So what do we want to do here? Number one, easiest way to go about changing somebody's symptoms is to modify the range of motion by having them do a floor press. So they do a bench press lying on the ground. By having them do board presses where they put a couple boards on their chest and they're not going through that full range of motion, or doing something like a spoto press where they bring the bar down, stop 1 to 3 inches off the chest and then press up. By modifying and taking away those last couple of degrees of shoulder extension, we'll really commonly see that brings somebody's symptoms down really rapidly, but still allows them to push heavy weight that does a great job of translating into their actual bench press. In fact, if you look at a lot of powerlifting programs, you will see the traditional bench press, but you'll see a ton of volume of floor presses and board presses because those actually tend to emphasize the triceps a little bit more, the lockout strength. And for most athletes, not all, for most athletes, they tend to be a little bit more limited in their lockout strength in the bench press than their ability to move the weight off the bar. So you really commonly find that will actually bump somebody's performance up quite a bit when you do that. The other thing we can do is we can modify elbow angle like we talked about earlier, but a lot of times by coming really narrow and almost going like a close grip bench press where we keep the elbows right at the side, a lot of times that will also really change their symptoms pretty rapidly and allow us to keep them lifting heavily without irritating tissues that are already a little messed up. So up next, let's talk through the push-up and what we want to look through there. When somebody's dealing with push-up pain, there are a couple of cues that I find that really frequently will change their symptoms and allow them to start doing push-ups pain-free. So one of them is kind of the same thing as the bench press. I cue them to keep their scapula retracted. So I say, I want you to squeeze your shoulder blades together, or give them a better cue than saying scapula retracted. And if they do a push-up that way, it kind of creates the same thing as the bench press does, where they don't get quite as much compression on the anterior shoulder. Or we can cue them to create a little external rotation torque. So we have their hands on the ground, and we think of externally rotating the hands a little bit. A lot of times I'll put them on hardwood floors with sliders, and I'll have them actually twist their hands in and out, and then I put them back on rubber floor and say, now imagine you're still trying to twist those sliders out, but because their hands are on rubber floors, they don't actually twist. Creating that little external rotation torque or that little scapular retraction will very frequently decrease what people feel in terms of anterior shoulder pain during push-ups. The problem with that is, if you really emphasize that external rotation torque, if you really retract your scapula and you test a max set of push-ups, number one, you're going to be slower in every rep. Number two, you're not going to be able to do as many reps. So if we're talking about a CrossFit athlete, this is going to kind of negatively impact their performance a little bit. So then we have to have a discussion with them on like, this is a great way to allow you to continue doing push-ups when they show up in the workout. We have to understand that you're going to be a little slower with that. You're going to feel it a little bit differently than you typically do in like a traditional push-up like you would be doing. But this is a modification that's going to let you keep training and doing what you love. And then we learn to kind of scale that back as their symptoms calm down a little bit. Like earlier, I also want to look at shoulder extension range of motion, just like the bench press. And very frequently, just modifying the range of motion here will decrease their pain, just like the bench press as well. So a lot of times I'll put an ab mat underneath their chest. So we limit those last few degrees of shoulder extension, and then they do a push-up. If they feel like that makes it significantly easier, we can throw a band around their back so that that band is resisting their lockout to make the lockout portion a little bit more difficult. Now we've decreased the range of motion, but we've kept the intensity of the movement a little bit higher. So that's a great way to go about training that movement and working on the push-up. And just like the bench press, quite frequently we'll see people that are really wide with their elbows, creating that T-body position and getting them into more like an arrow position does quite a bit better as well. So that's the push-up. The third movement that we'll really see people have issues with is the dip. And because the dips, especially ring dips, take the shoulder through significantly more range of motion, a lot more shoulder extension. Dips tend to be more sensitive in this than any of the other three movements that we're talking about today. So typically I'll find that bench press and push-ups become pain-free before dips start to become pain-free. So just keep that in mind in terms of what you're typically going to see from a clinical progression. There are a couple of specific and unique requirements to the dip. Number one, if that individual is doing a dip and their torso is leaning forward as they go down, that will lead to more force and load being placed on the anterior shoulder. So I typically want to see them staying more upright and stacked in their torso positioning. Then I want to look at where the rings are positioned in relationship to their body. We'll see a lot of times where as individuals come down, they'll actually let their arms come really far behind them, the forearm staying vertical, and you'll actually see the rings move back. And the rings will move behind the shoulder, the glenohumeral joint. If the rings move behind the glenohumeral joint, we've significantly increased the moment arm around the shoulder joint. So it's going to be a more stressful, more mechanically inefficient positioning. What we want to see instead is that as they come down, the rings are moving directly towards the glenohumeral joint. And it's really incredible how quickly that will change somebody's symptoms. I mean, if you're standing here right now listening to me, if you're not driving, you can try this out. Take your arm into shoulder extension as much as you can with your hand coming straight up your side, and you'll feel a little tension on the anterior shoulder. Now, if you straighten your elbow out a little bit to where your elbow is now not at maximal flexion, but it's now kind of vertical, or your forearm's vertical, you'll feel that tension on the anterior shoulder increase just with that little bit of elbow extension. And now if you translate that to rings where your body is supporting your entire body weight just versus just being hanging out there in the air, I think you'll understand how that's going to create a little bit more issues if those rings are getting behind the body. So vertical torso, rings stacked over. Again with this, we're going into tons of shoulder extension. So it's going to be really important for us to analyze range of motion of shoulder extension, because if that's limited as individuals drop down into a dip, you will see the shoulder kind of anteriorly tilting quite a bit. We talk significantly more about bench press mechanics and dip mechanics in clinical management of fitness athlete advanced concepts. So again, if this is a population you want to specialize in, be sure to check out ptoниce.com and look for upcoming course releases on advanced concepts there. I hope this gives you a couple of specific tips for these movements that we don't talk about quite as much because they're typically not emphasized as much in CrossFit programming. But if you start to become well known in the fitness athlete population, you will see CrossFitters dealing with this, and you will certainly see powerlifters, bodybuilders, Olympic lifters dealing with these issues alone. And hopefully these tips will give you a few things that you can use to really quickly modify people's symptoms so that it can keep training and then ultimately get to the long-term solutions for them not having issues anymore. Hope everybody has a great weekend, and we'll see you next time.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.